Welcome to Nursing P.A.L.S, where we learn together, share stories from the heart, and work as one towards better healthcare. Haven't hit subscribe yet? Please do. It helps us grow and keep making awesome videos for you. Thanks for being with us.
Welcome to our channel, where we simplify complex medical concepts for easy understanding. Today, we're diving into the fascinating world of abnormal perfusion, a critical aspect of our body's functionality. From understanding its pathophysiology to exploring various preventive measures and treatment options, we'll be breaking it all down. However, it's important to remember that this information is intended for educational purposes only and should never replace professional medical advice. Remember, always consult with a licensed healthcare professional to navigate your health responsibly. Abnormal perfusion, a complex medical term, but what does it really mean? In essence, perfusion refers to the delivery of blood to a capillary bed in the body's biological tissue. When this process becomes abnormal, it means there's an alteration in the distribution of blood to the body's tissues. There are several types of abnormal perfusion: hypoperfusion, hyperperfusion, and maldistribution, each with its unique characteristics. Hypoperfusion or underperfusion occurs when there's an insufficient supply of blood to the tissues. This could be due to a blockage in the blood vessels or decreased cardiac output. On the other hand, hyperperfusion or overperfusion is the exact opposite. It happens when there's an excessive blood supply to the tissues, often resulting from inflammation or certain types of tumors. Maldistribution of perfusion, the third type, is a bit different. It's not about too much or too little blood supply, but rather an issue of distribution. Here, certain areas of the body may receive more blood than necessary, while others may not receive enough, creating an imbalance. The differences between these types of abnormal perfusion are crucial as they impact the body differently and require different approaches for management and treatment. For instance, hypoperfusion can lead to tissue damage and organ failure if not addressed promptly, while hyperperfusion could result in swelling and increased pressure on surrounding tissues. Maldistribution, on the other hand, could lead to a mix of these problems depending on the areas affected. Understanding these differences is a crucial first step in diagnosing and treating abnormal perfusion. But remember, these terms are part of a larger spectrum of conditions, each with its own set of causes, symptoms, and treatment options. So, we see that abnormal perfusion is not just one type, but a spectrum of conditions. Each type has its unique challenges and requires a thorough understanding to effectively manage and treat. In the next sections, we'll delve deeper into the pathophysiology of abnormal perfusion, its risk factors, and prevention strategies, so stay tuned. Now that we have grasped the basic understanding, let's dive into the pathophysiology of abnormal perfusion. Abnormal perfusion, at its core, involves an imbalance in the supply and demand of blood flow to the body's tissues and organs. This imbalance can occur due to a variety of reasons, including obstructions in the vessels, alterations in blood pressure, or problems with the heart's pumping ability. When a blockage in the blood vessels occurs, it hinders the blood's ability to reach certain parts of the body. This can lead to ischemia, a condition where tissue is starved of oxygen and nutrients, causing cell death and potential organ failure. Examples of this include heart attacks and strokes, where the heart muscle or brain tissue is deprived of blood supply. Changes in blood pressure can also lead to abnormal perfusion. When blood pressure is too high, it can damage the blood vessels and the heart, leading to conditions like hypertension and heart failure. On the other hand, low blood pressure can cause inadequate blood flow to the body's tissues and organs, potentially leading to shock. Heart-related issues such as heart failure or arrhythmias can also disrupt perfusion. In heart failure, the heart can't pump blood effectively, leading to fluid buildup in the lungs and other tissues. Arrhythmias, on the other hand, disrupt the normal rhythm of the heart, potentially causing inefficient blood flow. With abnormal perfusion, the body's cells can't function properly. Oxygen and nutrients are necessary for cells to produce energy and carry out their functions. Without adequate perfusion, cells may die, leading to tissue and organ damage. Over time, this can result in serious health conditions, including heart disease, kidney failure, and stroke. In essence, the pathophysiology of abnormal perfusion revolves around the interruption of the normal flow of blood, leading to inadequate delivery of oxygen and nutrients to the body's tissues and organs. This imbalance between supply and demand can cause a cascade of detrimental effects, damaging cells, tissues, and organs, and potentially leading to life-threatening conditions. Understanding the pathophysiology gives us a clear picture of the changes occurring in the body. Knowing the risk factors can help us prevent the disease. So what are the risk factors for abnormal perfusion? Let's take a closer look. Some of the most common risk factors include age, high blood pressure, diabetes, high cholesterol, smoking, and obesity. Age is a factor we can't control. As we get older, our arteries can narrow and harden, leading to less efficient blood flow. High blood pressure or hypertension exerts extra strain on our blood vessels, which can cause them to weaken over time. Diabetes and high cholesterol can cause damage to our blood vessels as well. Excess sugar in the blood can lead to inflammation and narrowing of the arteries, while high cholesterol can lead to plaque buildup, further narrowing the arteries and impeding blood flow. Smoking and obesity are lifestyle factors that significantly increase the risk of abnormal perfusion. Smoking damages the lining of the arteries, while obesity increases the strain on the heart and blood vessels. Now let's discuss prevention. A healthy lifestyle is key. Regular exercise, a balanced diet, and maintaining a healthy weight can significantly reduce the risk of abnormal perfusion. It's also important to manage conditions like diabetes and high blood pressure under the guidance of a healthcare professional. And of course, quit smoking if you're a smoker. Early detection is also crucial. Regular checkups and screenings can help detect any abnormalities in blood flow at an early stage, allowing for timely intervention and treatment. Remember, prevention is always better than cure. Let's keep our blood flowing smoothly for a healthier life. Diagnosis is the first step towards treatment. Let's explore how abnormal perfusion is diagnosed. Abnormal perfusion, a condition where blood flow to the body's tissues and organs is compromised, is typically diagnosed through a combination of laboratory tests and diagnostic procedures. Blood tests can reveal signs of decreased oxygen levels and other related complications, while imaging studies such as MRIs and CT scans can help visualize areas of poor blood flow. Diagnostic procedures like angiography can provide a detailed view of the blood vessels, helping doctors identify any blockages or abnormalities. In this procedure, a special dye is injected into the blood vessels, which then shows up on X-rays. This gives a clear picture of blood flow in the body, allowing for a more precise diagnosis. Now let's talk about safety considerations. It's crucial to remember that diagnostics aren't without risks. For instance, contrast dyes used in angiography can cause allergic reactions or kidney problems in some individuals, especially those with pre-existing health conditions. Therefore, a thorough medical history and assessment are necessary before proceeding with these tests. In addition, patients should be monitored closely during and after the tests for any signs of complications, such as discomfort, swelling, or changes in skin color around the injection site. Accurate diagnosis and safety considerations are crucial in managing abnormal perfusion. Treatment involves a combination of nursing care and medications. Let's delve into the nursing care for abnormal perfusion. The primary aim is to improve circulation and ensure adequate oxygenation to tissues. This may involve strategies like elevating the affected limb to reduce swelling and improve circulation, encouraging regular movement to prevent blood clots, and providing a diet rich in fruits, vegetables, lean proteins, and whole grains to promote heart health. When it comes to medications, there are several options that doctors may prescribe, depending on the cause and severity of the abnormal perfusion. Antiplatelet agents, such as aspirin, are often used to prevent clot formation. Anticoagulants, like warfarin, are used when there's a high risk of blood clots. These medications work by reducing the blood's ability to clot, thereby improving blood flow. Another group of medications are vasodilators. These include nitroglycerin and hydralazine, which work by widening blood vessels, thereby improving blood flow and reducing the heart's workload. In cases where there is severe pain due to lack of blood supply, doctors may prescribe pain relievers. Beta blockers, such as atenolol and metoprolol, may also be used. They slow the heart rate and reduce blood pressure, which can help improve blood flow. In some cases, calcium channel blockers like amlodipine may be prescribed. They work similarly to beta blockers, but they also relax and widen blood vessels. While these medications can be effective, they're not without side effects. These can range from mild, such as nausea or dizziness, to serious, like bleeding or shortness of breath. It's vital for healthcare providers to monitor patients closely to manage these potential side effects. As we can see, the treatment of abnormal perfusion involves a multidimensional approach, with nursing care and medications playing a crucial role. The goal is to manage symptoms, improve quality of life, and prevent further complications. Remember, each patient is unique, and what works for one might not work for another. Therefore, the treatment plan should be individualized, taking into consideration the patient's overall health, lifestyle, and personal preferences. The right care and medication can significantly improve the quality of life for those with abnormal perfusion. Education and collaboration play a pivotal role in the management of abnormal perfusion. Understanding this complex condition is not just for healthcare professionals, but also for clients. It's crucial for individuals diagnosed with abnormal perfusion to grasp the nature of their condition, the importance of medication adherence, lifestyle modifications, and routine checkups. Knowledge is power, and in this case, it could mean the difference between effective disease management and preventable complications. Interprofessional care, on the other hand, emphasizes the importance of a team approach. Doctors, nurses, pharmacists, and other healthcare professionals each have a unique role in managing abnormal perfusion. By working together, they can provide comprehensive care that addresses all aspects of the condition, from diagnosis and treatment to ongoing support and care coordination. Remember, dealing with abnormal perfusion is not a solitary journey. Empowered with knowledge and the support of a healthcare team, managing abnormal perfusion becomes a collaborative effort. Awareness of potential complications helps in early detection and treatment. Abnormal perfusion can lead to serious issues like ischemia, where tissues don't get enough blood, and hypoxia, a condition marked by lack of oxygen. These can result in organ damage, particularly in heart and brain, leading to conditions like heart attacks or strokes. In severe cases, abnormal perfusion might lead to tissue necrosis, a serious condition where tissue dies due to lack of blood supply. Being aware of these complications can help in timely intervention and better management. Let's sum up everything we've learned about abnormal perfusion. This condition occurs when blood flow to your body's tissues and organs is inadequate, affecting their function. It's a complex process with various types, each with unique implications for health. The pathophysiology involves alterations like vasoconstriction or blockages, leading to reduced blood supply. Risk factors range from lifestyle choices like smoking to medical conditions such as hypertension. Prevention strategies include regular exercise and a healthy diet. Diagnosis often involves laboratory tests and diagnostic procedures, with safety considerations being crucial. Treatment involves nursing care, medications, and sometimes surgical interventions. Patient education and interprofessional care are key to managing this condition.
Thanks for watching. Love what you see on our channel? Consider buying us a coffee. Click on the link below for more. Your support goes beyond just the caffeine boost. It's a vote of confidence that fuels our passion and dedication to delivering the best content possible. Together, we can make each video even better and continue to grow and improve. Much love and gratitude from all of us at Nursing P.A.L.S. Don't forget to like, comment if this was helpful, and subscribe.